Endometriosis is a clinical condition where the cells that normally live inside the uterus go outside of the uterus and implant into the pelvis. They can implant on the bowel, on the bladder, on the outside of the uterus, on the ovaries. Most women who have endometriosis actually aren't even aware that they have endometriosis and don't suffer symptoms. So we think of endometriosis as being symptomatic or being asymptomatic. Women who are symptomatic from their endometriosis most commonly suffer from painful periods or painful menstruation, what women call cramps. They may or may not also have significantly heavier flow than other women who don't have endometriosis, but it's really the pain around the time of the period that is the #1 symptom that women suffer from who have endometriosis. If we want to know an absolute 100% diagnosis that your symptoms are absolutely from endometriosis, that actually requires a laparoscopy or a surgery where we place a camera inside the abdomen and actually directly look to see if we see these endometriotic cells growing outside of the uterus. They're not risk factors like smoking or jogging or having intercourse on your period or any type of herbal medications that we know that cause it. There's a lot of urban myths about things like that, like don't have sex on your period or it'll give you endometriosis. Those are not true. We're not aware of any sort of behavioral things that women do that increase their risks for endometriosis. So for endometriosis, we have a lot of treatments. Unfortunately, I often see women who have had their endometriosis treated simply by being given narcotics or strong pain medicines during their period to control the pain. And that may work to control the pain, although there's some unpleasant side effects from taking pain medications. Where what I like to do is try to approach the cause of the endometriosis, the actual endometriotic cells. And typically we do that with hormonal medications, the most common of which is birth control pills. And we have some special types of birth control pills these days that are particularly good at suppressing endometriosis and controlling the symptoms. I often give women birth control pills in such a manner that they only have 4 periods a year, and that's safe if you're doing it under physician guidance and with birth control pills. There's stronger medications for patients that have more severe disease. Sometimes we use injectable medications, injectable hormones to suppress the endometriosis as well. But I find it it's very rare. Almost never do I have to prescribe a patient narcotics to be able to control their periods and their pain with their periods anymore. We have really good medical options to treat them otherwise. One of the myths that I see patients coming in with a lot is that their endometriosis is something that they just have to live with it. They will have been told by family, friends, perhaps even other physicians, just live with it. It's only a week out of the month. Just deal with it. And that's a very devastating diagnosis to tell a woman that 1/4 of the time she's going to suffer from pain, perhaps be unable to attend work, attend school, to care for her children. So I really want patients to know that we can make them feel better, almost always. I have not had a patient with endometriosis who I haven't been able to make feel better. Maybe not completely pain-free, but we can almost always get those symptoms much improved from what they are without any treatment at all. And there's a lot of hope for future treatments for better control with less side effects for women on the market.